Hello, and welcome to Virginia Medicaid Waivers, a presentation by the ARC of Virginia. This is especially for individuals with developmental disabilities, family members, educators, and disability service providers who want to learn the basics about Medicaid waivers for people with or at risk of developmental disabilities. The ARC of Virginia is a state chapter of the ARC of the United States, the nation's oldest and largest organization of and for people with intellectual and developmental disabilities and their families. The ARC's mission is to promote and protect the human rights of people with or at risk of developmental disabilities and actively support their full inclusion and participation in the community throughout their lifetime. In this presentation, we're going to cover Medicaid health insurance, Medicaid waivers, waiver services, eligibility criteria, the application process, and tell you how you can get help and more information resources. Most people find that they have questions, but they also find that as the presentation goes on and goes into deeper detail, their questions are answered. But we welcome any questions that you may not have that may not be covered. If you're totally new to waivers, the information can be overwhelming, but don't worry if it doesn't make sense all at once. Let's get started. Let's look at the terms Medicaid and the term waiver separately to understand what they mean. Medicaid is the insurance that pays for waiver services. Waiver means that the requirement that Medicaid services be provided to all in the state is not required. Instead, the services in the waiver are only for select populations. So put together, a Medicaid waiver provides the insurance that pays for the services that are only available to a select defined population. When a person has a Medicaid waiver, they have the health insurance that people with Medicaid have, and they have access to additional waiver services that only people with Medicaid waivers may use. Medicaid waivers, also known as home and community-based care waivers, were created so that states could provide alternatives to having to live in an institution such as a nursing facility or a hospital-like setting to get needed services. Let's look at the what and the why of Medicaid waivers. A Medicaid waiver is a long-term support system for people of any age with long-term care needs. Many people with developmental disabilities have those long-term care needs. The waiver offers a menu of services and supports for people to live in the community versus the nursing home or the hospital-like environment. There are numerous waiver services, including things like personal care, respite, employment services, daytime services, residential supports, skill building services, nursing, environmental modifications, and much more, depending on the type of waiver. Waivers are the only public funding source for long-term developmental disability supports. So you may be used to having services if you're a school-age person and having all those services paid for. But once you leave the public school system, there is no entitlement service, and waivers are the only long-term funding source. Medicaid is overseen by the state and federal government. Virginia's state Medicaid agency is the Department of Medical Assistance Services, or DMAS. The federal agency is the Centers for Medicare and Medicaid Services, or CMS. Both of these agencies have financial and regulatory roles. You may be wondering, who pays for Medicaid waivers? Waivers come from state and federal tax dollars. When a state decides to have a Medicaid program, and it does so happen that every state in the U.S. does, the federal government mandates that certain services be provided, and they are all listed here on the slide. EPSDT is a set of services that are only available to children starting at birth up until the 21st birthday. The other mandated services include family planning, health clinics, home health services, hospital services, lab and x-ray services, Medicare premiums, nurse midwife services, nurse practitioner, nursing facilities, physician services, and transportation. States may choose to provide optional services, and Virginia has chosen to provide these optional services: case management, home and community-based waivers, hospice, intermediate care facilities for people with developmental disabilities, mental health, psychology, optometry, physical, occupational, and speech therapies, podiatry, prescribed drugs, prosthetics, and home health. What is noteworthy on here is to realize that home and community-based waivers are an optional service that states may choose to provide, but they don't have to. For adults with Medicaid waivers, some people may have to pay for some DD or CCC plus Medicaid waivers if they have income over $1,292 per month. This is called patient pay. It is paid each month. There are some exceptions for people who are working. Once a person has a waiver, then they must apply for Medicaid if they don't already have Medicaid health insurance. They will have a Medicaid card, they will have the Medicaid health insurance, and they are eligible for the services in the waiver that they have received. Most people will be enrolled in a Medicaid managed care organization. CCC Plus, or Commonwealth Coordinated Care Plus, that's the name for two separate things that share the same name, CCC Plus. So it can get kind of confusing. Those two different things are the CCC Plus Managed Health Care and CCC Plus Waiver Services, but they are two different things. HIPP, the Health Insurance Premium Payment Program. This is a Medicaid program. So for Medicaid members who also have employer-based health insurance, the employee may be eligible for the Health Insurance Premium Payment Program. What HIPP does is pay a portion or the total health insurance premium for qualifying plans by reimbursing an employee. So an example would be a person has a waiver, one of their parents has an employer-based health insurance plan that qualifies for the HIPP program. There's certain qualifications that apply. And let's say the premium that the family pays that comes out of the employee's check is $600 a month. Well, it's possible if the person meets the HIPP criteria that that employee will get reimbursed that $600 a month every month. So an application separate from Medicaid eligibility has to be filed with the Department of Medical Assistance Services. You may call 800-432-5924 for more information. And on the slide, you see the website address to learn more about the HIPP program. The two waiver programs that we're going to talk about are the DD, or Developmental Disability Waiver Program, and the CCC Plus, or Commonwealth Coordinated Care Plus waiver. So in the Developmental Disability Waiver, which we'll just refer to as DD Waiver, there are three subtypes of waivers. They are the community living, the family and individual supports, and the building independence waiver. The other waiver program is the Commonwealth Coordinated Care Plus waiver program. It does not have subtypes like the DD waiver. The CCC Plus waiver was created in 2017 when the old ED/CD and tech waivers were combined into the new CCC Plus waiver. Let's compare these two waiver programs. Looking at the DD waiver program, a person must have a developmental disability diagnosis. It provides a comprehensive menu of up to 32 services for home, work, community, medical care, skill building, and much more. Up to 24/7 support is available through this waiver. It has a large but needs-based waiting list, and it's operated by the local community services boards. Let's go over and look at the CCC Plus waiver. You must have a disability diagnosis, and note, I did not say developmental disability diagnosis, and a medical need. That is very important, that the person must have a medical need. There are fewer services in this waiver, about 9 services. They're more focused on care in the home. Care can be provided in the community. It has nursing, but it does not have employment or residential supports or skill building services available in it. It does not have 24/7 support. There is no waiting list, and it is operated by the local health and social services departments. To be eligible for a waiver, there are 3 criteria that a person must meet. They are diagnostic criteria, functional criteria, and financial criteria. The financial criteria is the same for both waiver programs. Many people think that for Medicaid waivers, the parent or family income is considered. That is not true. Parent family income never counts for the person who has the waiver. There's no resource limit for children. So a child could have millions of dollars and there's no resource limit for children. But once that child or any person 18 years or older, there is a monthly income limit of $2,349, that's per month, and there's a resource limit of $2,000. Now we're going to focus only on the CCC Plus waiver and the services that it provides and the application process. The CCC Plus waiver has adult day health care, personal assistance services, private duty nursing, respite care, services facilitation, assistive technology, environmental modifications, personal emergency response system, and transition services. We're going to take a look at personal and attendant care. That's a service that most frequently is used by people who have this waiver. So for personal attendant care, a child or adult receives assistance from an attendant to help them with everyday activities such as dressing, bathing, eating, toileting, and supervision. Some waiver services may be delivered through the consumer-directed model. In the consumer-directed model, the person with the waiver or their parent or family acting on their behalf recruits, hires, trains, supervises, and fires the attendants. In the agency model, attendants are provided by an agency who handles all of those functions, the recruiting, the hiring, the supervising. The rule for this service is that parents of minor children and spouses of those with waivers were not allowed to be paid as care attendants. Parents of children 18 and older may be paid as attendants. However, due to COVID-19, parents of minors and spouses of people with the waiver may be paid as attendants. As of now, this flexibility is in effect until January 26, 2021. And I also want you to make note that this same service is also available in the DD waiver. Assistive technology pays for technology that assists the person with the waiver to be more independent in activities of daily living and communication. Devices are usually portable and may include specialized medical equipment, communication devices, or controls. And to use this service, there is a process. It involves getting a prescription for an AT evaluation from a qualified Medicaid professional, and it is limited to $5,000 per year. So a person may have purchased up to $5,000 worth of assistive technology per calendar year. This is also available in the DD waiver. Environmental modifications are physical adaptations to the home, vehicle, or work site that enable the person to function with greater independence to help ensure safety and welfare of the individual. So there may be modifications to the home, which could be anything like a ramp, making rooms accessible, security features. Modifications to a primary vehicle might include lifts, ramps, hand controls. This is also limited to $5,000 per calendar year, and environmental mods is also available in the DD waiver. Private duty nursing is continuous care up to 16 hours a day. It's only covered if there is no private health insurance. You have to meet very specific criteria using highly specialized medical technological support. So a person on a ventilator might be a person who would be using private duty nursing, and this is also available in the DD waiver. Respite gives the caregiver, the parent, a break from providing care. It also gives the person with the waiver a break from their caregiver. And this may be provided in any environment. It could be in the person's home. The person could go to someone else's home or go to some other environment. 480 hours of respite is permitted per year. This is a consumer-directed and an agency-directed service. It's also available in the DD waiver. Adult day health care. That usually takes place in a group setting where some people gather together. They engage in social and recreational activities. It's typically used by people who are elderly or who cannot be left alone. Transitional services are for people who are transitioning from a nursing facility to a community home. It provides up to $5,000 for expenses of making that transition to move into their new home. The personal emergency response system, think Life Alert, or it could be a Medicaid management system. The individual must not be able to use a phone in an emergency. They must be 14 years or older. They are left alone for a portion of the day, and they must have the cognitive ability to use the device. So that's personal emergency response, often called PERS. Now let's look at the eligibility requirements for the CCC Plus waiver. People with a disability or of any age, or people 65 years or older, if they have mental illness, that does not qualify as a disability by itself. They must have some other disability, and of course they may have mental illness also. They must meet the criteria for a nursing facility, and they must have a medical or nursing need. The Uniform Assessment Instrument, or the UAI, is the assessment tool used to determine if a person meets the 3 criteria. The UAI assesses a person's social, physical, and functional abilities. The screening is completed by a nurse from the health department, or if the person is in the hospital staff does the screening. To request a screening for the CCC Plus waiver, this is part of the application process. The first thing you do is contact your local Department of Social Services, and it could be in your locality that you have to contact the local health department. Different areas have either the health department or the Department of Social Services as the initial point of entry. So when you call, you need to be able to report your or your child's disabilities, you or your child's physical or health diagnosis, and you need to report what waiver services you need. You do not want to say that you want Medicaid to pay for therapies. Many people think that if they get this waiver, then they will have Medicaid, which they will, but they really only want it so that they can use it to pay for therapies. And if that's the reason you state that you want this, then they're not going to be very willing to assess you for this waiver. So the screening may be done in a person's home, or it may be done virtually or telephonically now, especially during COVID. When you call to request the screening, be prepared to answer these few questions. Now we're going to move over to the DD, or the Developmental Disability Waiver, and the services that it provides. So, what does the DD waiver pay for? You may remember earlier we said that it has up to 32 services in it. So they fall into some broad categories such as employment and day options, consumer or self-directed options, residential services, behavioral crisis, medical services, and a pretty long list of others that are called additional options. You may remember earlier that in the DD waiver program, there are 3 categories of waivers. The different waivers have different services, so not all types of waivers have the same services. The 3 types of waiver are the community living waiver, the family and individual supports waiver, and the building independence waiver. When your needs change, you may request a different waiver to get the services that you need. So let's look at these 3 types of DD waivers. The building independence waiver is only for adults who are 18 years or older. Usually the person with the waiver owns or leases their own home or apartment. They're not living with their parents or their family. And it is intended for people who have minimal support needs and need fewer services. The family and individual support waiver is for someone of any age, child or adult. The person may live in their own home or apartment, or with friends, or with family. And this waiver has more extensive supports, including medical and behavioral. And you can live, if you're an adult, with 24/7 support with this waiver. And actually, anyone of any age could have 24/7 support with this waiver. And the third waiver is the community living waiver. That's for people of any age. The person may live in their own home or apartment, or with friends, or with family. This includes extensive supports also, including medical and behavioral and 24/7 support. It is the only waiver with the segregated group home and sponsored residential services. So the main difference in DD waivers really comes in with residential services. You will see on the left on the chart, there are 6 residential support services there. Independent living services is only for people who have the building independence waiver and need fewer hours of training or support to live in their own place. It is not in the family and individual supports waiver or community living. Shared living is where a person lives with another support and receives some supports from the other person, and it's available in all 3 waivers, and this is for adults. Let's jump down to sponsored residential. In sponsored residential, 2 people may live with a waiver, may live with a family in the family's home, which is a licensed home. The group home service is only available to people with a community living waiver, like sponsored residential. So there you get a good picture of how different services are available in different waivers. There are many, many other waiver services, and we're not going to be able to have the time to go into all of these individually, but for employment and day services, for employment especially, supported employment as a service, workplace assistance, benefits planning. There is a group day set of services. Those are usually center-based. Community engagement and community coaching are also available so that people are involved in their local community. Companion services, electronic home-based services, think smart home. There's community and employment transportation. There's community guide, peer mentor supports. This waiver has skilled and private duty nursing, and there are behavioral supports. But don't forget, in both the DD and CCC Plus waivers, there are those services that are in both waivers: personal care, respite, the PERS, assistive technology, and environmental modifications. So let's move on to who can be eligible for the DD waiver. So what is the definition of a developmental disability? It's a chronic disability before the age of 22. It's caused by a condition other than mental illness. And again, like the other waiver, a person may have mental illness, but they must have some other condition that's classified as a developmental disability. The person needs or likely will need lifelong or extended plan services, and the person must have substantial limitations in 3 or more areas of life activity. And the life activities are self-care, communication, learning, mobility, self-direction, capacity for independent living, and economic self-sufficiency. Here are just some examples of conditions that may be a developmental disability, meaning they occurred before the age of 22. Autism, brain injury, cerebral palsy, Down syndrome, intellectual disability, muscular dystrophy, epilepsy, spina bifida. Again, those are just a few examples. So in the DD waiver, functional criteria is assessed, and a person's functional needs are assessed by determining the level of help or assistance needed, whether it's from another person or from a mechanical or technology system, compared to a person without a disability of a similar age. In the DD waiver, a person is assessed in 8 different areas that you see listed on the slide: health, personal care, motor skills, communication, behavior, task learning, community living skills, and self-direction. For the DD waiver to be eligible, then the person must also be at risk of placement in an intermediate care facility for people with intellectual or developmental disabilities. The VIDES, the Virginia Individual Developmental Disability Eligibility Survey, is the assessment tool that's used to determine if the person meets the functional criteria for the DD waiver. And so it assesses the person's functional dependencies in the 8 areas that we looked at on the previous slide. A representative from the local community services board does the VIDES assessment with the person who is seeking the waiver and any others they wish to be present and give information. For children, parents are always included, and for adults, often family members are included and help provide information relevant to what's asked on the VIDES. So when the VIDES is being done, it's looking at, again, what kind of help does the person need to perform skills or activities compared to a person of a similar age without a disability. This is a time when you focus on the challenges that the person has. This is a time where you're focused on the person's deficits. One thing that people often aren't aware of when they are having the VIDES assessment done is that we're to look at the individual's current functioning, presuming there are no help or helpers of any type available. So there are no parents, there's no family, no paid or unpaid service or technology is in place. So think about somebody getting dressed. There are many, many steps to getting dressed. First of all, you have to know what the weather is and what would be weather appropriate clothing. You have to be able to get your clothes out of the drawer or out of the closet. Can the person put their clothes on? Does someone need to tell them how to put their clothes on, or do they need to physically help them put their clothes on? So think about the person as if no parents, no family, nobody else is around, and how they would perform. The ARC of Virginia encourages individuals and families to learn more about the waiver services and the screening processes before requesting a waiver, before requesting a screening for the CCC Plus and the DD Waiver programs. We strongly recommend that you have your own copy of the VIDES or the UAI with you when the screening takes place. To request a DD waiver screening, you contact your local community services board. You want to be prepared to identify what your child's disability or developmental delay is, why you want a screening. And again, don't say you want to get this waiver because you want to have Medicaid to pay for therapies. You do not have to already have Medicaid to be screened. You don't have to have that for either of these waivers. But if you're offered a waiver, then you must complete a Medicaid application. When you get screened for the DD waiver waitlist, you're going to be put on a waitlist. I'm sorry, when you get screened for the DD waiver, you're going to be placed on a waitlist. And this waiver, as we said earlier, has a large needs-based waitlist. And waivers are awarded based on need. It's not a chronological wait list. If you're on the wait list, you may apply for individual and family support funds. And if it's a person who is able to live in their own place, so someone over the age of 18, and they maybe have the CCC Plus waiver and they're waiting for the DD waiver, or if they have other natural supports and they can live in their own place, then rental assistance funds are available. With COVID-19, many changes have been made to the Medicaid system. Medicaid, DMAS, and the Department of Behavioral Health and Developmental Services have made numerous changes to what is allowed in the Medicaid system. Some of these flexibilities include that parents of minor children and spouses of people using waivers may be paid personal care attendants, and as we said earlier, that's until January 26, 2021. Face-to-face requirements for screenings, assessments, visits, planning meetings are not required and may be done virtually or somehow electronically. There are other flexibilities that have been made due to the coronavirus, and the ARC of Virginia has a website. It's our coronavirus website, and there you can keep up with the Medicaid flexibilities and changes, because changes can happen at any time. You will find updates on a question and answer form, or let's say paper, that's especially for people with developmental disabilities, and we keep this updated as changes occur. Help, maybe you need more information or you're overloaded. That's not unusual. All of the information we have covered is on the ARC of Virginia's website and on YouTube. If you need help getting started and want to learn more about the screening processes for the waivers, feel free to contact us for individual consultations to guide you through this process. You may also want to view our presentation on what to do while you wait to learn more about the screening processes and what to expect. So our website is available to you. You may call us at 804-649-8481. Email is info@thearcofva.org, and we also have our YouTube channel. So please stay in touch with us, and thank you for coming to this presentation. We would love to have your feedback, And there you see again our website, email, telephone number, and we're also on Facebook and Twitter where you can stay in touch with us and keep up with what's going on. So again, thank you.